When it comes to pregnancy and COVID-19, there's still much to learn, but here's what we know so far.
We do have now a number of studies that suggest that actually risks to the pregnant woman in the third trimester are not particularly severe, which is great. So when women in the third trimester were compared with non-pregnant women, pregnant women didn't have more incidence of severe disease, pneumonia, or death. We also believe that newborns and fetuses whose mother is infected with COVID-19 are not at particularly higher risk of developing the virus. There have now been several studies looking at things like amniotic fluid and breast milk, and COVID-19, at least in the third trimester, has not been cultured out.
Although the direct health effects of COVID-19 on fetuses and newborns appears to be minimal, expecting mothers still endure the social ramifications of the virus.
You're having social isolation and the impact that that's having on moms and parenting and birthing people, and then hospitals with needing to decreased visitors are also making policies that are social policies that impact birthing people, like not allowing to have a partner or assistance or a doula. We know that moms need social support. Going from this a space where birth is something that we usually shared with communities and shared with a partner to something that's now done alone is a big culture shift for people, and it's also a shift for it's a traumatic shift because it's not a shift people are making by choice. The trauma that's happening inside of birth is going to increase the anxiety that people feel, the birthing people feel. And we already underdiagnosed pregnancy, postpartum depression. We underdiagnosed postpartum anxiety. So adding in now having people isolated and alone really will heighten and make that feeling, those birth traumas and those anxiety, depression numbers go up.
And while some women are choosing home births during this pandemic, giving birth at a hospital may be the safest option.
I know that people might be afraid of what's happening in hospitals, but it is inside of a hospital, you have the equipment that you need, you have the people that you need to ensure that you will survive and thrive in childbirth, even if it has to be, unfortunately, that you're not there with your partner. So that is always going to be a safer option than trying to have an unassisted by yourself at home birth.
Home birth is super common in rural communities around the world. So where we work in Kenya and where we work in Guatemala, 80% of the deliveries are done out in the community at home. And the issues are that when complications arrive, they often are not predictable. So like a postpartum hemorrhage is a relatively common complication of delivery. I'll put it at like 12%. And we can't predict it. It happens in low-risk women, it happens in high-risk women, it happens in women of every background. And what I worry about is if you're laboring at home, how long will it take to get to the hospital? When you get to the hospital, will the process be more cumbersome because of everything else that's going on right now? I firmly believe that delivery in a hospital is better.
But for women of color, giving birth at a hospital can also be dangerous.
You have people who are saying, well, I'll just have a baby by myself, or I'll do a home birth, or I'll move to another place, all these things, because the lack of trust and feeling safe inside of an institution alone for Black birthing people is real. And there's a study done out of UNC that showed that we're less likely to get our pain managed when we are in labor than a white person who's also laboring. So those are the kind of things that we need social support, and we need someone there to make sure that we're getting our pain addressed, that we're getting our bleeding addressed, that we're getting all of our issues and needs addressed in the hospital. And we know the difference between a lot of times what's called a near miss, which is a person who almost dies in childbirth, and a person who actually dies in childbirth. Many times when people tell those near miss stories, they had someone with them that had to advocate.
And until the coronavirus ends, health experts recommend these guidelines for birthing and non-birthing people.
There was a new guideline that was actually published in the British Medical Journal, and they're advising that women over 28 weeks pregnant who are frontline healthcare workers not work with patients, not have direct patient care. Women who are less than 28 weeks, they're actually saying you can work with patients, but use PPE with every patient. For the general public, we need to be in this mindset of whenever we go out, whenever we talk to anyone new, that's a potential exposure. So we should be protecting ourselves. Every single encounter is a potential exposure. Social distancing is huge. Hand washing is huge. Anything that comes in from the outside into your home should be treated as if it has COVID, at least right now. Until proven otherwise, that's how we should live our daily lives.